in the legislative chambers. And with that, we'll go to roll call.
Wade,
Here.
Festerson,
Here.
McNally,
Here.
Rogers,
Here.
Weiss, Jones, Wilkin,
Here.
King, Espinoza.
Item 2 is the approval of the minutes for the month of March. Is there a motion to approve? There's a motion by Weiss. Is there a second?
Second.
Second by Wade. Roll call.
Wilkin,
Yes.
Wade,
Yes.
Rogers,
Yes.
Weiss, McNally, Festerson.
Yes.
Item 3, there's 5 items, A through B. Not knowing of anything that need to be removed, is there a motion to approve items A through E?
Motion to approve.
There's a motion by Festerson. Is there a second?
Second.
Second by Wilkin. Roll call.
Festerson,
Yes.
McNally,
Yes.
Rogers,
Yes.
Wilkin,
Yes.
Weiss, Wade.
Yes.
Okay. We'll go to item 4 and presentations, air quality and sanction.
Okay. So, bring that up and share. Okay, just hit the button.
All right, thank you. Good morning, Sharks. I'm here asking for $200,000 for 10% of our program. No, I'm just kidding. But reality is, today is tax day, right? So I always want to make sure my program represents the best for those taxes and what the people get for their value. So just looking at that on tax day, it kind of represents the same as the Shark Tank. The company is trying to go out and, make enough money that the sharks feel invested in it. Well, I feel the same for my programs, that, the public feels like they're vested in my program. They're getting a good return for their money. And that's just kind of how I run the programs that I do. Today you'll be getting a program update from me. I am the supervisor for the air quality, sanitation, and sanitary engineering programs at the Douglas County Health Department. I've been supervisor for, 16 years or so. So always looking forward to updating you on the things that we do with our programs. I know Eric was here 2 months ago, so he gave you some of the values of our inspections and stuff like that. So I figured I'd do this in a slightly different manner, to where you get to see between 2024 and 2025, was there an increase in service, a decrease in service, that kind of stuff, just to see how our programs are doing. So I'll start with the air quality department. We provide what's called ambient air quality monitoring. So basically these are stationary monitors on rooftops, in some facilities. We're monitoring the atmosphere, basically. We also do indoor air quality, which includes stuff as mold. We do some checks on occasionally like odors and stuff like that, but that's really difficult when somebody asks us to identify some kind of odor in their house. But we will go out and we will look at that. One time we found a snake in a wall, something like that, it was a benefit. We went out there and found out why the place had an odor. Mold, we're mostly education on mold. And then pollen counts, which just started, we started early this year. And if you know the weather, pollen was relatively high early in the season. So we went ahead and started our pollen counts. For our ambient air quality monitoring, we look at many pollutants, ozone, particulates, which include PM10 and PM2.5, which are really small particles, carbon monoxide, sulfur dioxide, nitric oxides. We also have a weather station that we maintain at our in-core site. And also we send some filters in for chemical speciation, which breaks down those particles all the way down to, is there gold in the air? You know, they haven't found much, but you know, maybe at some point they'll find some gold on our filters, and we'll be in luck for a program. We have many locations around Douglas County, and outside Douglas County, we do monitoring for the state of Nebraska as well. So we pick up some monitoring in Washington County, which is Blair. We also do Bellevue, monitor out at Bellevue. So the state figured we're close enough that they'd supply some funding for us to go ahead and monitor those locations. We also do Ralston. We got to monitor downtown, central Omaha, northeast Omaha, and then our main in-core site, which is one of 75 monitors in the United States that is an in-core location, which has multiple pollutants in it. And it's right next to the health department. Basically, if you look at the warehouse and the roof of the warehouse, it's on there. I always want to do a shout out to our DouglasCountyAirQuality.com website. We spent quite a bit of time with GIS, basically designing a website that the public can look at our daily air quality. It's hour by hour. All the stuff is reported pretty much real live time. I expect these instruments to get even better with time, to where it'll be minute by minute data, you know, where you can just see trends as they're happening. Hours are a lot better than when I started in 2003. Basically, we would collect a filter, take it back to the lab, we'd weigh it, and then maybe the next day you'd get a result of how the air quality was the day before. Not real practical for notifying the public. Also on our website, you can find our forecasting. Basically, if you look in the top corner with the 64 number, you know, it'll show the real-time air quality data as it's happening in that hour. And then down below, you'll find the pollutant details of what currently between ozone, particulate matter, PM2.5, what those are running currently. And then every morning, including this morning, did a forecast for the air quality index. It was all good today, so you're in luck. But basically, you can sign up for that forecast as well on enviroflash.info. And every morning you'll get an email based on what levels you would like to see. You know, if you only want to see yellow, which is moderate, that email will only show up with values that are above moderate to unhealthy. Or if you only want to see the unhealthy category, then that's the only time you would receive an email. So it's a very nice program that the EPA kind of set up that we use. Also, a couple years ago, we teamed up with the National Weather Service, which has been a blessing. Before, we would basically just use our internal Douglas County to push out information, which we still do. But the Weather Service allows us to reach a lot more individuals, including stuff on phones, Alexa, you know, all those things. I'm sure if you had an Alexa, you've already seen or had to turn off one warning this year for air quality. Basically, like my Alexa, you know, next to the bed, it'll flash yellow, and then you ask it, you know, hey Alexa, what's the notification? And then it'll say there is an air quality, you know, warning until such and such time. And that's done through the Weather Service, that they're actually able to get that stuff out to the public. I've heard nothing but good things from organizational groups in Omaha that originally when I came, they're like, we can't get this information. And now they're like, we always know what's going on with the air quality. We also have news stations that have really picked up on air quality as well. Well, you'll see them actually doing some forecasting and predicting what the air quality will be for the day. So I don't mind that. The more people involved in air quality, the better, I believe. I mean, they are meteorologists, so if they want to try to predict air quality as well, I'm good with that. Why do we monitor? So in 2023, we had a lot of Canadian fires. The picture right here up in the corner is some of the wildfire smoke from Canada that came down in 2023, and we had extended days in 2023 with fire smoke in the area. And then 2024 was much better. We only had a couple days of wildfire smoke, and then this year it hasn't been too bad either. The Kansas fires, they burn every spring. They're burning right now, but it should be easing up as we're talking, because as the grass gets greener, they don't burn. They're trying to get the cedar trees, out of their prairie. And if you look at the bottom picture, there's a few, cedars still scattered in, but that's really what you would like the prairie to look like without a bunch of cedar trees in them, or juniper. But the problem is they're very invasive species, which we found out kind of in central Nebraska this year, where they had a huge fire. And if it was just grassland like this, I'm pretty sure our firefighters would be able to, keep that under control, because it would quickly burn. It wouldn't burn with the heat intensity when you get those trees in there. But that was some of the problems we had in western Nebraska earlier this year. We didn't see hardly any of the smoke from that fire, and we've had one day this year from the Kansas fires that put our ozone into an unhealthy category. So we've had only one day where we've had the wildfire smoke that you could really smell outside, and it did, elevate our air quality in Douglas County. I just like to throw this out there. This is ozone over the years. I know a lot of time people ask, are we doing anything? Is anything improving? If you look at the ozone numbers, basically since 1997, you can definitely see a sharp decline in ozone across Douglas County. That's due to a lot of the environmental issues, that we're putting on some of the factories and things around here, better filtration system, different regulations, all that stuff leads to the development of ozone in our area. So if you look at the charting, ozone is definitely on a decline, which is good, because ozone is colorless. You can't see it, you can't smell it, so it's one of those pollutants that cause a lot of harm for the public, but it's invisible. So if we can get that under control, that's much better for our Douglas County population. Particulate is hard to control, because a lot of times it's led by wildfires or a burn, or whatever else is out there is causing that particulate. But when you go outside that there's particulate smoke, because you can smell it, you can see it. You look at a tree, it's fuzzy, you can see particulate. But ozone, I think it's way better that those numbers are on the decline. Some other stuff we do, like I said, we do pollen. On our website, you can get our pollen forecast. Trees have been very high for, pretty much the month. We're already starting to see some grasses in there, which they usually come later. So, whatever weather is going on, it's starting to lead to a lot more pollen in our area currently. Mold, we did 235 mold calls in education in 2025. That was a slight decrease. We also did 20 mold inspections. That's where the public will ask us to come out, look at their home, see if it's mold, and do an observation, and then write a letter to the landlord, that kind of stuff. We did 20 of those inspections. The good thing with mold lately is the City of Omaha inspectors, when they go out, They're actually, working a little more with mold. They'll point out a water leak and then, put on their thing unhealthy conditions if they see some mold in the environment. And then that leads to more regulation that the landlords are really forced into, cleaning up, repairing, and fixing the mold issues that are going on in these. So shout out to Omaha City Codes on that. Some new things we're working on in air quality. The health department has got a new software. It's called Achieve It. Basically, we can put years and years of data into the software and then combine it against different trends. Right now, I'm just putting in data, straight data, and then trying to introduce something else to it, like let's provide more education, and then see if those trends on some of these go up or down. One of these is, so on the left, which is this one right here, that's our air quality website. This is number of visitors to the website. So you can see in 2023 with the fires that were going on and all the smoke, we got a lot of visitors there. And then when we don't have bad air quality, the number of visitors, of course, drops a little bit. And then every time we start seeing some air quality issues, it starts going up. But we have seen more of a trend towards more visitors to our website. What I would like to introduce to that is maybe get more education out there, kind of drive more people to our website and kind of use it. And then I can put more things on the graph, like when we did a press release or whatever, and see if that is a driver for more people to our website. So hopefully the next time I'm here, a lot of these graphs and charts, I'll have secondary things on there so we can see when I add stuff to it, is that a driver for the public or not? This second chart here is all of our mold complaints and calls. A lot of times it's after rains, of course. We get heavy rains or something like that. People get water in their basement or water in their apartments, and then we start seeing a big uptick in calls. Really wet years like 2018, of course we get a lot. Not exactly sure 2023, why we had a lot of calls, but we did. And then the bottom, oops. Oh, this is, never mind. I was totally wrong. So this is our EnviroFlash enrollment. This is the people that sign up for, that's why 2023, there was a lot of people. This is why people that sign up for my daily forecast for air quality. And as you can see, the peaks are usually during burn season, that more and more people sign up to get a forecast. In 2023, we had a lot of people sign up. Down below is the mold calls, and they're relatively even. What's new for air quality? This year, we most likely will be setting up what's called a near road monitor. Since population went over 1 million people, we are required to have a near road monitor, which will have nitrogen dioxide, carbon monoxide, and PM 2.5. Our most likely site is this Phillips site, right off of basically 72nd Interstate. The main reason we want a location like that one is if you look at the picture on your left, there's good parking there, and we don't have to like park on the interstate or something like that to get to our monitor. That's the last thing I want for our employees, is to actually have to sit on the interstate or park their car out there and be in danger. Where this, if the city okays this site, most likely it'll be built later on this year. And then we also have to do what's called photochemical assessment monitoring, which is called PAMS. We're going to be looking for VOCs. This monitor will be located at the in-core location. It's basically a GC instrument. We'll have to do some training on how to run the GC instrument. It's different than all the other instruments that we've ran So we'll have to do a little training. Some of this other stuff we already have at NCORE. It's a requirement for PAMS monitoring, but we already got some of that, so we won't have to bring a whole lot in there besides for maybe mixing height and then hourly precipitation.
Russ,
Yeah.
what does NCORE stand for?
National Core Monitoring Station. I don't know. The EPA has a term for it, but we just kind of go with NCORE. National. I'll try to come up with it before the end. So those are the exciting things for our air quality department that we're looking forward to in 2026. My other sections that I have are sanitation and sanitary engineering. They provide a lot of services. Pest management, trash, litter, garbage, swimming pools, septic systems, mosquito surveillance, domestic animals, hoarding, dog waste, demolition permits. And then there's a few in there that we do that isn't even in the list. We did 445 nuisance inspection complaints. That's up 4%. We also did 121 rat and rodent inspection complaints in 2025. That's up 27%. Is this thing going to play? Last time I didn't play the video of the mouse, but since I'm the only presenter today, I was hoping to play it.
Go for it.
And of course, all this stuff in the office, it works really good.
Russ, let me ask you this while you're trying to pull it up.
Yeah.
When you saying, when you're saying the rat and rodent inspections have went up, I thought I heard somewhere, and I might be wrong, that some of the rat and rodents, when the weather gets real cold, it kills them off. And when it does not get as cold as it does not eliminate as much of them, so that number that's supposed to die is not gone, and so then you have new breeding and increases that. Did I hear that wrong, or is it just me putting together something?
I would think that's definitely possible because mice are always looking to seek shelter, in some kind of shelter in the winter.
Mm-hmm.
If you have warmer environments, they can survive better outside. You'll probably tend to have higher breeding as well with warmer temperatures, not having that extreme cold.
Uh-huh.
So I think that would be a legit reason that they would.
Well, it's not a rush. Can one of you all that study this quantify if that what I heard is right or wrong?
Right. Okay.
Go ahead.
I had a question to you, Russ, if we're waiting for the video to come up anyway.
Yeah.
To your comments about interactions with city inspectors as it applies to mold inspections and then certainly pest inspections. We've had, I feel like, a lot of attention around that in the last few years, both with the city doing its rental registry program and then obviously a lot of interaction with Omaha Housing Authority on those issues. Any updates there, or can you expand upon how you feel that's going with city inspectors? I think you talked about them being more maybe aware of the issues you're monitoring and dealing with. I believe they have the enforcement capability. You have the assessment capability. And I think during those timeframes, it was a matter of making sure we were all coordinating, right?
Correct. We've always worked with Omaha City Codes. They did a good job with OHA. Even us working together with OHA, trying to get some of those problems solved. We haven't had, of course, as many complaints on OHA as we did. What was that, two years ago? So just judging by the number of people kind of calling in and issuing complaints and stuff like that, I believe we're doing better. Any complaints we get, we give to OHA and have them, look into it. And they seem to get out there and try to solve the problem a lot faster than they did before. So in that way, I'd like to say kudos to them that it does seem like things are working better. I think the inspections by Omaha City Code, where they're doing, a number of inspections on these apartments, help alleviate some of this. We haven't had as many bed bug complaints either, so I think that is good as well. Just don't worry about this thing. It's a mouse trying to squeeze into a little tight space. So,
You wanted to know what that meant. He's telling you.
National Core Multi-Pollutant Monitoring Stations.
And similar
It's
to
amazing that slipped my brain.
so similar to city code inspectors, your service
it's-
is complaint driven, right?
Yes, all of ours is the public or tenant will call in,
Mhm.
and then we'll call them back, set up a time to go meet them at their apartment or home, and then do a walkthrough with them, basically on what they're seeing. Usually, whether it's bed bugs, cockroaches, mice, any of those issues that they're having, they'll go out and look through that. If there are codes issues, our people will call codes and let them know, hey, there's a massive water leak, or the electrical is wrong, or whatever, and have codes go out there. And we'll also give codes number, and if anybody's on the call, it's 402-444-5371, that they can call them on any kind of codes violations. And codes will do the same thing where they'll take the call the person back, and then line up an inspection.
Okay.
So is it working? Or?
No, you don't
Okay,
get to see
go
the
for it.
mouse video. Maybe
No, don't worry
if
about
I'm
it.
still working here next year, I can figure out how to do this. If Dr. Hughes doesn't fire me for this. No. All right. We also do swimming pools, both residential and commercial pools in Douglas County. Apparently, a lot of people like pools, so we do have a lot of residential permits that continue to go in since probably 2022. I don't know if that's a COVID thing or just people really want pools in Omaha, but we have seen a big increase in pool permits, residential pool permits. And what we do with them, we definitely look over the plans of the pool. They have to have a barrier so kids don't access the pool, self-closing latching gates, no gaps that exceed 4 inches, an alarm system on the back door unless they have like a pool cover, and a fence. And thank you for working with us on the new code for fence requirements. We definitely believe every residential pool should have a fence around it to keep kids out, and that was somewhat being challenged. And I think our new code that we worked with you guys and got in is definitely a positive for our program. Commercial pools, we also do commercial pool permits and inspections. Basically, we look for all the different chemicals in the pool and pHs and cyanuric acid. We want to make sure the main drain is visible in the pool. If you go to a pool and you look and it's just dirty and cloudy and you can't see the drain, maybe you should give us a call or something. We look and make sure that the emergency telephone is working and functional. Class A pools have to have certified lifeguards. B and F pools have to have shepherd's crook and a ring buoy. All gates to the pool must be self-closing and self-latching. Outlets, drain covers, all properly installed. We check out the decks of the pool to make sure, there's no tripping hazards and stuff like that. They don't have the lawn chairs, out right next to the pool that people will trip over, fall in the pool. Pool operator must be available. So we check a lot of things on these pools, and it's all for public safety. We want people to swim and have a good time and not get sick. And we take it very seriously. Our inspectors, they look at each of these and make sure that the pool will close I know we had a case already this year, and we appreciate, you guys working with that pool to kind of make sure that people follow our ordinance and operate safely. And I just want to show you a.
Do you have an update for us on that case?
It's open. The pool is open. They passed the inspection, so we open them. They're operating. I want to show you a quick video of a local pool a couple years ago that had a near drowning, and just to show you how quickly something like this can happen. As you can see, like, this pool is crystal clear, right? There's people all around the pool. People are playing, we got a little Instagram going on here. All the kind of stuff that is around a pool. You wouldn't think.
That's an apartment complex?
Apartment complex, yep. And so you have the one kid, he gave the other kid a buoy to kind of float. But he lost contact with the buoy. And you probably have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and 10 people just in camera range that can see what's going on here. And then there's another, 3 or 4 people on the side that you can't see with the camera. And just how quickly this can happen. And even with that amount of people at the pool, nobody can really see what's going on. This kid was from a different country, so he didn't speak English. So I'm sure he originally was calling out, in a different language, like a help, but people around the pool didn't quite understand what was going on. And normally what happens when somebody else tries to help and they're not a great swimmer, they get drugged down. Luckily, that kid fought off the one kid to try to get back. And that's usually what you're taught too, is, try to, they're going to drag you down. So try to kick their arm out. If you're not a great swimmer, you both don't want to drown. So, and as you notice, still people at the pool they really don't know what's going on. Yeah, local.
Does he make it to the buoy?
Does he make it to the what? It was a near drowning, so he did survive.
He did.
Yeah. Luckily, this lady with her baby here I guess, was a nurse. So now you're finally starting to get some attention from people at the pool, which is really amazing, right? That you have all these people around the pool and somebody's still almost drowned. One of the reasons why we always say never swim alone, because you never know. You think you're a strong swimmer, but maybe you're not. It can happen pretty quickly. But luckily this pool, so on stuff like this, we will be called, if it's a near drowning or a drowning, we will be called out to that pool, basically to do an inspection to make sure it wasn't the pool's fault for the drowning. We'll run the chemicals and all that stuff. Basically just do a pool inspection to make sure, that the person can't claim liability against the pool, that it was their fault. It doesn't matter if it's the weekend, a holiday, or whatever. We'll go out and do that. Basically, the person has to be, for a near drowning, applied CPR to be considered a near drowning. And then if that happens, we have to come out.
And that gets registered somewhere and it gets to you, somebody, the doctor or somebody?
Regulations say the pool operator has to call 911 and the state of Nebraska. So whenever something like this happens, they have to make a call. and then 911 will call. I'm first on the list, and then I believe Eric should be on the list, but we got to verify that, and then Dr. Hughes, and it's like a call tree from there.
Okay, so like those signs are there that says, I'm assuming they got a sign out there for liability purposes, swim at your own risk or something.
Yeah.
And so unless somebody in the apartment complex is monitoring this, how would they know that it happens, and how would it show up on your scale?
Right.
If that kid regains consciousness and he just goes about his day.
Yeah, we would never know. If somehow.
So it could slip through the cracks.
It could slip through. I mean, if somebody drug them out and they just had one friend there with them and they just got out of there, we would never know. Not all pools have cameras and that kind of stuff on them. So this one happened to, and they were nice enough to give us the video of it. And I think it's a good learning.
Yes, great learning.
Video to show just how quickly something like this can happen. So in 2025, our commercial pool inspections and openings, we did 518 commercial outdoor pools, which was an increase of 26%. Our commercial indoor pools, which we do more in the winter, we did 179. That was a decrease of 37%. But the reason for that is we lost an employee. I mean, they left. But we had to replace them, and of course, then you're training. So by the time they got out in the field, now we're catching back up. So next time you should be able to see those numbers increase again. Residential pools, we did 301 inspected and plan reviews for pools in 2025. So 301 new residential pools, which is why revamping the code for residential pools is so important to us, is that there are a lot of pools going in Omaha. We had no drownings or near drownings last year, which was great. We also do septic systems and wells. We issued 77 septic permits last year, which was a decrease of 30%, but we did 93 septic installations, which means we go out there, and over here on the right, you can see mapping. We got GPS units and stuff, and we map down to 10 centimeters exactly where the lateral lines are, exactly where the boxes are, the pipes and everything. So when a homeowner wants to know where their septic system is, we can tell them exactly where not to build a pool. We did 28 well inspections, which was down 44%. We had some community wells that went in for neighborhoods that weren't on city water. So that kind of decreased some of that. And also we had a lot of permits issued in 2024, which fell into 2025, which is why we had an increase in installations. They had the permits out there, they just didn't install them. So in 2025, they installed them. So this year we had less permits issued. So we'll probably have a little less septic installations as well. Land, of course, in Douglas County is getting more and more scarce all the time. So eventually, most people will be on city sewer and city water. I don't know when that'll be, probably 15, 20 years from now. All of Douglas County will be homes, but it will happen at some point that we will no longer have to do this, besides for those that are already out there. Mosquito surveillance, 'tis the season. I have seen skeeters out there already, so we are out doing some larviciding even today. We got a lot of larvicide. We try to hit any kind of retention ponds and whatever else to try to keep those mosquitoes from becoming adults. So our crew is out trying to get some of that. We set 54 mosquito traps last year. We had one West Nile virus detection in our mosquito surveillance. So that's not too bad for a year. Normally we'll get one and then they'll just keep going for 3 or 4 samplings, but we only had one. Another great thing we did last year is we gave out 273 boxes of repellent, mosquito repellent, in the vending machines. It was all I had to put in there, and they basically sold out, or not sold out, they're free. but the public really liked it. So we're trying to get like a little, some money this year to increase our number of boxes of repellent and start the season early in the vending machines to get this out there, to try to get the public to use it more. And down below is tick sampling. We're also going to do some more tick sampling this year to see if we can find some invasive species that are moving in. We've already found a couple that weren't supposed to be in Douglas County. So the more tick sampling we do, the more we'll probably be able to find. Domestic animal permits and inspections. Another one where we revised the livestock ordinance. No roosters, maximum of 10 chickens. This is great for us as well, to be able to redo that ordinance, just so it says in the ordinance there are no roosters in Douglas County. That helps a lot. We did 302 animal permits in 2025. That's a 19% increase. I expect that number probably to only go up. It just seems like people really like chickens, so we'll probably do more. We do bee permits. We try to keep the main domestic animals out of Douglas County on permitting. And to your left is one of the sites with just way too many chickens, and that's a reason why we wanted this ordinance with a maximum, so we don't have, your neighbor doesn't have like 45 chickens in their backyard. We also do environmental site assessments for companies. Basically, we're looking at, do they have EPA symbols? What kind of toxics do they have before they buy a piece of land, or when they buy a piece of land? All this stuff is in a database, and we have somebody check it and give them that information before they decide to either buy that property or build on it, so they know what they're looking at and what they have to remediate. And those assessments were up 17%. For sanitation and sanitary engineering, we're looking at a few things this year. The state basically said they're no longer doing pool inspections, which means we have to, we already do pool inspections, commercial pool inspections, but we will have to, modify our database in some ways. We were sending all of our inspections and stuff to the state, and they were recording all the inspections, so we'll have to implement a little bit better database on our side to keep and store all the records of our pool inspections. So we'll have to do that. We have a couple ordinances we still want to work on and improve. One would be the commercial pool ordinance. So eventually you will see that come your way after we get those in that you'll have to look at. And of course, at some point we will fly the drone. The person that left had his pilot's license, was getting to the point where we were going to fly the drone, decided they were leaving. But the new employee, Jessica, she has passed her pilot's license and her medical. She is okay to fly. We got to get 4 hours of flight time, and we're in. We are flying that drone, and we are going to do some larviciding. Speaking of the staff, this is my great staff. That's them out, working on a rooftop in lightning. Actually, this is AI pictures. So don't take these as fact. I just wanted to show, how AI is improving. These were really easy to do on just taking standard pictures and turning them into something funny. But reality is, AI is coming. It's something you're going to have to be aware of and be able to actually look and decipher, is this real, is this not? Because I'm sure as board members, you'll be getting some things that are not true. So this is my great staff. They do everything for me. They have a lot of work to do, so they're always busy, but they're always smiling, and they're always happy to do it. They love public health. This is Lizzie, Neil, Chrissy, Jared, John, Jessica, Carmelita, and Alan. I got some of the most experienced crew at the health department, which I'm very proud of, and they love public health. And we're here, like I said, the Shark Tank thing. We want to make sure that we are doing what we're supposed to be doing, not throwing money away, not doing any of that. We're doing very good work for the public's dollar. So I really appreciate the staff. We could always use more, of course, but we get done with what we have, and I appreciate that. So thank you. Any questions?
Russ, what was the reason the state gave for not tracking pools anymore?
It was money would be my main thought. It was LB 759 that basically got rid of them doing pool inspections, RV parks, camper, mobile home parks. You know, they just took all that stuff off. And so now it's up to the county or city levels to take that on. So that's something we have to decide. Are we doing mobile home parks on top of campsites? You know, is the health department going to take that on? That'd be something we'll probably have to bring to you as well, and have some kind of ordinance if we're going to be the ones doing that responsibility. It's just more of a, you know, one more line that'll be added to the multiple lines that we're doing. So.
And what's the status right now on the North Omaha coal plant?
North Omaha coal plant, Dr. Hughes is going to give an update on that. We just had a talk yesterday as a group on what our plans are going forward with that. So I'll let her update you on that.
Russ, is the board signed up on this daily email thing you sent out?
I have not seen a board member on it.
Can you put the board on there?
I can't add people on there. I wish I could.
Okay.
I've tried before, but basically they send a confirmation email. So I could put a name in there, but then there's like a confirmation email.
Is there a link you have to fill?
Yeah.
Can you send the link out and give them the option?
Yeah, I can send that. It would be nice if you guys all signed up, so my little ticker will go up.
Yeah. Okay. Anybody else? All right.
All right, thank you.
Appreciate it. Thank you. Dr. Hughes?
All right, I apologize. I'm super sniffy because the tree pollen is high. But I'll hit a couple points that kind of follow on from what Russ presented. First of all, I'll just start with North Omaha. So I have had the opportunity, I think I've told you at other meetings, to meet with at least one or two of the board members. But last week I had the pleasure of meeting with a couple of people actually from OPPD, and they were very open to discussing potential plans going forward, a way to collaborate, not only us and them, but also really thinking about what other resources in our community could we tap into and kind of build out almost a coalition of organizations that can assist. I can't give you too many details on that because those details have not been fleshed out first. And right now they are working with staff that I have designated to kind of be a point person for them and really to flesh out some plans that might be possible working together very collaboratively going forward. They would like to put those plans together to present to their board so that whatever the financial ask is their board has the opportunity to look that over. I also have another meeting with another board member here in the next couple of days. So that work is ongoing and it is, there are things happening. I was very excited to get to actually sit down with OPPD and have some conversations. It sounds like they're very open and amenable to figuring out some kind of collaboration, whether that's exactly what I had proposed or if that is, some of their ideas too coming in. And so I will be very happy to send some updates and bring it back to this meeting for conversation as we have a better idea of what we would like to propose going forward. I also have been able to join some ad hoc committee meetings for North Omaha and hear directly from citizens about what some of the needs are and the hopes that they have going forward for this collaboration. And those are things that I am working to keep really front and center in those conversations that we're having, so that whatever it is that we do end up doing, it really does center the needs of the community and really helps to protect their health, give them the information that they need to make good decisions for their health. So more to come on that, but those conversations are absolutely happening and they're ongoing at this time. Russ also talked a bit about LB 759, which passed, which the pool part doesn't impact us hugely. There are some things that we have to tweak there, but we already inspect pools here in Douglas County, so we're not taking on additional pools per se, but there is some additional administrative work that we'll have to do with those. Like he said, the LB 759 also puts the responsibility for inspecting mobile home parks and recreational camps on city or county governments, and local health departments are included in that. There is language around that in the legislation, and those conversations are definitely still ongoing between ENDWI, and that's what we're calling them, ENDWI. Everybody has a different way to pronounce it right now, but basically the state who used to have the responsibility for those things, and really fleshing out what that means for local jurisdictions. There could be a city component to that, and so the plan is, as ENDWI is actually starting to schedule more of these meetings and we kind of have a better understanding, we want to know from the city if there's any piece of this that they're wanting to take on, because we don't want to step on toes. What do we need to do? Do we want to take on mobile homes and recreational camps? I will say, I think that the number of mobile home parks we have here in Douglas County is 16, but I don't know how many units that is. Do we know yet? 1,500, that's a lot. So mobile home inspections require a bit more legwork. So you're not just, necessarily looking at the mobile homes, you're looking at the environment that they're in, the septics, the sanitation around that. There is a little bit more work that goes into those. And so that's a conversation that we'll need to have. It's not a mandate, so it doesn't have to be done. However, for health, we think it's really important. I will say I've seen some horror stories in terms of mobile home parks and sanitation, so I have a special interest just in making sure that we keep those environments as healthy as possible for the residents who are living there. And then I think we only have one recreational camp that's actually in Douglas County, so that wouldn't be hugely onerous for us if we need to take that on. Definitely our outlying counties have more of that than we do, but there's only one that falls within our county lines. So update on that, those conversations again, ongoing. The session ends this Friday, hopefully. So I think that as everything kind of closes out, we'll be seeing those conversations increase. The community health worker training endorsement did pass. I think I did update you on that. That was LB 912. And so that work will hopefully be starting here in the next few months or so. And then there was a bill that proposed increase in taxes for tobacco products, and unfortunately that did not pass. So I think the original request on that was to increase the tobacco tax by $1. That did not go through. There was another proposal for a lesser amount, and I believe that also did not go through. So it's unfortunate for health and just discouraging the use of tobacco that did not go through, but that's where we are right now. I would anticipate we'll probably see bills like that in the future. We are getting ready to start doing some wastewater scanning. Mr. Festerson, thank you very much for your help on the city side to get all of that moving. So we're working with Wastewater Scan, and they will be doing sampling as soon as they actually get the test kits. So that's the one thing that we're waiting on there. This was something that was really important to us for a couple of reasons. For one thing, the wastewater surveillance that the state does is no longer reported, so we don't get that data anymore. But also, we have two really large events coming up this summer that we feel is important that we have increased surveillance. One of those, of course, is the College World Series that happens every year. We like to know, if there are increases in certain diseases that are, being brought in or being spread within the community when you have large gatherings like that. Also, the World Cup that's happening in Kansas City this summer. While that's not happening here locally, we are hearing about what is expected in terms of people who are coming into the country, potentially renting vans or RVs and kind of making a big tour of the United States sort of situation out of their trip as they're coming in to watch the FIFA, is it FIFA? The soccer game. We'll just say that, the soccer games. We're expecting that there could be quite an increase, not just in domestic, but in international travel through the area. So we felt that increased surveillance was something that was going to be extremely important. We will be able to see that data pretty clearly, and I have a list of what they look for. So in that wastewater testing, they're looking at influenza, RSV, COVID, HMPV, which is a virus, norovirus, enterovirus, Mpox, Candidiasis auris, Hep A, measles, West Nile, parvovirus, and rotavirus. So there's a nice batch of different things that will be looked for through that, and so we'll get that data on a regular basis. I want to just remind people that this is not a tool where you can actually drill down and find a person who has a disease or an infection. It just simply tells us that it's present somewhere in our community. So that is great information that we can share with physicians in our primary care, urgent care, and emergency departments so that they can have really a better list in their mind of what they could be seeing when they have patients in front of them. Some of these diseases have symptoms that overlap quite a bit, and so it's helpful to, if we're seeing a big spike in a certain kind of virus in the community, to let them know that, so that as they're seeing those patients, they can think, oh, I wonder if it's this one thing that we're seeing. They can do testing and hopefully rule it out, or if there are cases, find it so that we can treat that appropriately and limit spread. So we're looking forward to that and very excited about that. That has been a project that Justin Frederick has undertaken. And just a quick note on Justin, he is in Baltimore this week for a preparedness conference and was invited to DC this morning to have breakfast with the Nebraska congressional delegation to talk about the importance of public health and preparedness. So he is there right now. I was getting updates while Russ was talking. So he is currently with them. It was just a very brief meet and greet elevator speech. Here's why this is important. Pretty excited that he got that opportunity. A little jealous because DC is pretty amazing, but that's where he is today. We were able to, we're working on our budget right now. Our FY27 budget is due to go in to the county, I believe, Friday. So we're just finishing that out. And we're actually really excited to let you know that we've increased our overall budget for FY27 by about $6 million. And that puts us up around $30 million for our operating budget. And most of that is due to new grant opportunities that have come forward. So those are pretty specific grant dollars that will go toward very specific programming. One of those is the Rural Health Transformation Grant, which will enable us to hire additional community health workers, which we're very excited for. Our community health workers do incredible work in the community. This will allow us to have more of them that we can embed in more areas in our community. So we're very much looking forward to the ability to do that.
Dr. Hughes,
yeah.
before you go off that, let me ask you, because I had that peg to ask somebody on those reports you sent out. How are we getting a rural health action grant?
That's a great question. We were very surprised ourselves because we figured as a metro that Omaha and Lincoln probably would be excluded from this, but because Nebraska is considered a rural state, we were able to receive funding. We were eligible to go ahead and apply for funding for this, so we went ahead and did that.
Is this the 50 billion that was given?
Yep.
Okay. all
It
right.
is, and there are a number of tranches, if you will. So, one of them was for community health workers, which is the one that we're primarily using. There are others. There's grant money for like infection control. There's remote monitoring. There are a variety of tranches that the state's kind of managing, and different entities are eligible for different tranches. So we're not eligible necessarily for all of those, but we definitely wanted to take advantage of the community health workers.
One follow-up on that too, Lindsay.
Yeah.
I think that's correct. There's many tranches still unfolding. That was actually one of
Yes.
the first ones. So how much was received by Douglas County, and how many health workers will that fund? And then where do we anticipate they will be embedded?
Yes. I can't totally answer that because it's gone back and forth a few times, and I don't know where it landed this week, but I believe we will be hiring about 10 community health workers and an additional coordinator. So obviously that's quite a few. We already have a number of community health workers, so we are going to be able to really expand that. We'll need an additional coordinator to help coordinate all of the work that they do. But we are looking at placing those community health workers in a number of different places. That is Leah. Leah can give you the details on that. Dr. Casanave, she is not here today. She just got home from a cruise, lucky lady. But we will have more solid information, details for you on that next month. We're still working it out, going back and forth with the state. There have been a number of adjustments that we've had to make either within the budget or within the narrative or within the work plan. So I don't have exact details to give you right now. But I do know that we will be increasing the number of community health workers into North Omaha, which I think we're all really happy to hear about, South Omaha, and then within some organizations as well. 10, yes. Quite exciting. Which, and also we are in the process of hiring a couple of environmental health specialists, so a couple more food sanitation or food safety workers, and then an additional air quality person, which I asked for specifically to be the person who is our North Omaha air quality specialist, essentially. So that brings me to another point, which is our building. Our building currently, as you know, is too small for us. We have people shoehorned in basically wherever we can fit them. Our building also has a nasty habit of breaking frequently. So last week, the fire alarm got stuck and was sounding perpetually, essentially. So we sent a bunch of people home to work from home so that they didn't have to listen to that. We did have a couple of food inspectors that I really kind of want to shout out because they stayed and put up with it because they had food trucks coming in. They were expecting, I think, a big food truck event that weekend. They didn't want people to not be able to get the inspections they needed to participate. They stayed and listened to the alarm, which got shut off eventually for a little while and then came back on. And so Tamara and Diego were our two inspectors that stuck around and did inspections. I stayed down in the basement with them just in case they needed anything, but was really proud of them for just sticking it out and making that happen, knowing that their food truck people were going to need them and that income that they were going to get that weekend was pretty important. So back to our building. We have been in conversations with a couple of county commissioners Chris Rogers obviously knows about this. Roger Garcia, Mike Friend have been a couple of others that we've talked to. And we have gotten permission to start the process of either renovating where we are or finding a building finding a different building that is larger and could suit our needs. And so again, we literally just got the okay for this, and so we are very much excited to start considering some options that can hopefully give not just our employees a better working environment, but that will give us room to house the people that we are hiring, and that can really be a facility that the public can come into and feel comfortable and respected and have their dignity respected as they're coming into our building. And so more to come on that. There are some properties out there that we would love to take a look at. So we are still considering the possibility of renovations within the current building. We don't know yet which direction this will go, but we do have at least the blessing of some of our commissioners to move forward looking at what those options could be. We also were made aware recently of some pretty massive changes to the ADA rules, which will impact a lot of our electronic products. So our website, our, whatever is public facing essentially has to be ADA compliant, and those rules have changed pretty significantly. And there are some things that have to be done by the end of this month. And so we are not the only ones. Pretty much all of our county agencies are kind of in the mad scramble right now to hopefully get our websites as compliant as they can be. But this is going to mean some pretty big changes in terms of how we manage our website. Our dashboards right now are kind of our biggest worry, how we're going to really get those up and in compliance from an ADA standpoint. And so we're working with GIS to see how that might happen. We have a lot on our website. So each page, all of our social media has to follow these new guidelines. And so our supervisors have been working this week to identify which of our pages are compliant and which pages might need some altering. There is the possibility that we may have to take down some pages temporarily while we revamp and figure out exactly what we need to do to make them compliant. PDFs are one of our biggest struggles right now because PDFs evidently are not read by the readers that are often used by those with visual impairments. And so really figuring out how we can get the information that's up and on PDFs into a readable format is really something that we're struggling a little bit with, but we're working through it. Certainly we're not the only ones that are having that struggle. Our agendas and products, communications that we're putting out even for the board will probably look a little bit different. So you might see like some spacing changes and some font changes when you're seeing those reports and those agendas that are coming out for this group. So just be aware of that. We are well on track at this time to be okay by the April 24th deadline. I'm very grateful for all of my staff who were tasked with this. Felt pretty last minute for them, I'm sure, and they have really dived in and done some really outstanding work so far to not just get the things changed that need to be changed, but also working with all of the other staff in the department and helping to push work forward in a coordinated and efficient way. So very grateful. Justin is our point person on this project. Catherine Plumley, who was our accreditation coordinator. She's an incredible project manager. She and a couple of other individuals, Heather, has been instrumental in helping with some of this work as well. So just know that things might look a little bit different, and the reason is because it's time for us to be operating in a way that is accessible for everybody regardless. So we are working on that.
Dr. Hughes?
Yes.
Could you give another example or two of what it entails to be ADA compliant with
Sure.
what you're talking about?
Sure.
I mean,
Without going into extended detail, there are things like images that you post or that are public have to have a description with them so that a person can hover over an image and a reader will actually read the text that will describe to them what the picture is.
Since our photos are on there, can you be nice?
Absolutely. We will make you all sound like movie stars when we talk about your pictures. We have to make sure that so those sorts of descriptors are on pictures. There are certain color requirements so that those who have color blindness are able to see basically enough contrast that they can read things effectively or interpret a chart effectively, basically making the information visually consumable for them. So things like that, again, line spacing, we have to have increases in our line spacing, have to use sans serif fonts. If you don't know what serif versus sans serif is, talk to me afterwards. I won't make you go through that up here. But there are just a number of things. Font size, you have to have a certain font size. And then anybody that we link to also has to be compliant. So that's another piece, is that we have to, we have other organizations that we link to, and so we have to see how we're able to make sure that they're in compliance, and if they're not, how can we still get their information out in a way that's consumable for everyone. So there are some things that are a little bit complicated in there, but times change. This is not surprising. It's probably overdue, to be perfectly honest. People have been using the internet heavily for a lot of things for a long time, and so it's important that we as government agencies are able to give our information to everybody. Yes. So we're working on that. Okay. One other thing that I wanted to update you on this morning is as we have implemented an electronic health record system within our clinic setting, that has enabled us to pursue the possibility of billing insurance companies for services, which I'll just say will be voluntary. We're not going to make people, we would never turn someone away for not having insurance to bill. Certainly, there are people who don't want their insurance billed for a variety of reasons. We would still absolutely see those individuals. But there are certain things that we could bill for, which would help us to generate a little bit more revenue, to keep expanding our department and expanding the services really that are offered to our residents. And so in doing so, in order to bill, we also have to consider HIPAA. So typically, Douglas County Health Department has not been considered a HIPAA-covered entity. That's not saying we don't abide by HIPAA, because we definitely do, and there are some state guidelines that are even more stringent. So please know that everyone's privacy is absolutely protected, and we take that extremely seriously. However, our clinic setting will become a HIPAA-covered entity. I don't have a TBD for you on that just yet, because it will become effective upon our first billing. So when we are able to actually start billing, then the clinic setting, or so the STI testing and treatment and immunization clinics, basically those will be HIPAA-covered entities. So they'll have a few extra rules that they get to follow there. And Leah has been working out all of the details for what that means and what that will look like for us with Diane Carlson over in the county attorney's office. So just know that work is happening, and one of the requirements is that we notify you. And so I'm notifying you that we're going to becoming a HIPAA-covered entity in our clinic setting. And with that, I think I have given you plenty. I don't think there's anything else, but I'm happy to answer any other questions that you have.
I just have one follow-up on the mobile home park inspections that the state has now said it's going to be up to the counties, as well as the swimming pool and the public campgrounds. And you indicated, though, they're not mandated. Were they mandated at the state level?
So I'll clarify, pools are. So pools have to be inspected. And so our local health departments and jurisdictions around the state who have never done them before are learning how to stand that up. The mobile home and recreational camp are not mandated at the state level to be inspected, but some users have to have an inspected area. So like if Boy Scouts want to use a recreation park or a recreation camp, Boy Scouts of America has rules around what constitutes a recreational camp, and it has to be inspected for safety. So it's not necessarily that, I don't know if the state, did they have statute that said that they had to do those inspections, or was this something that NDWE just did?
I think it was a state statute, but I don't know if it said specifically how many times they had to be inspected.
Okay, so yeah.
Those are going to be sunset eventually.
Yep.
The full one won't.
Right. So the pool one, obviously, that still stands. The mobile home, so that statute sunsets, that would require NDWE to do those inspections with the mobile home parks and the recreational camp. But in the language of LB 759, essentially they said that local jurisdictions, whether that's city, county, or delegated to the health department, have the ability to do it. So basically giving them the authority to do those inspections. And so, yeah, they're not giving any money for it, you know. So I guess that's nice that it's not, at least those couple things are not an unfunded mandate per se. But from a health and safety perspective, I personally think that they're pretty important to do. So I think those future conversations about how and if and what that looks like here in Douglas County will be really important. Okay. Yes, Dr. Jones.
Good morning. Just wondering if you've had any input about like Nebraska Medicaid work requirements, or just have you gotten a lot of calls or feedback, and is the clinic kind of prepared for potentially an increase in the population of uninsured folks?
Yeah, we've certainly talked about it quite a bit. We do have a couple of people who are certified, if you will, to help people sign up for Medicaid. I would anticipate, honestly, that we probably, as we're bringing on all these community health workers, may want to certify all of them to be able to assist people, because I think the paperwork is going to be pretty onerous for folks, especially if they're having to recertify, twice a year. That is, I mean, it's quite a load to even just do it once a year, and so it can be very confusing. It can be very taxing, and so being able to provide that resource of somebody who can walk through it with people and help them get signed up, I think is going to be really important. Certainly, we have also talked about, okay, so more uninsured individuals in the community, how and what gaps can we fill? Honestly, with our current capacity, there's not a ton that we could do. But I will say that one thing we have considered semi-seriously is around vaccine and what we offer in terms of vaccine. Right now, the only vaccine that we get is through VFC and VFA. So that's the federal programs, vaccines for children, vaccines for adults. Unfortunately, those have some insurance requirements, and certainly we don't carry enough that we would be able to, just vaccinate everybody who lost their insurance. And so, as we're able to look for more funding and apply for more funding, is there the possibility of purchasing private stock, which would allow us to at least give more vaccine to more people regardless of their insurance status? That's something that we've talked a little bit about. You know, obviously partnering even more closely with organizations like Whispering Roots so that those who are losing health insurance probably also are losing maybe some of their food benefits, or you know, they're having to now choose between, do I buy groceries or do I go to the emergency room to deal with this thing that's going on? And so how can we assist with getting people healthy, nutritious foods to kind of supplement them, you know, whatever they currently have. So working more closely with folks like Whispering Roots who do that kind of work. These are things we've been brainstorming around, really how we might be able to do a better job of filling some of those gaps, because we know that those gaps are definitely going to be coming. And if anyone has any suggestions for that, we definitely would love to hear from you, our board. I have Jamin here.
Sorry. And if I can add one more thing specific to the work requirements, we've been trying to get the word out in every setting that we can around the new work requirements. The reality that in order to be eligible, you have to be able to demonstrate 30 days of prior work history or educational history. We've been working really closely with the Refugee, Immigrant, and Migrant Task Force to get that word out as well. But I think that this is a good opportunity to continue to expand education around the changes and the reality that there is now a work requirement that requires 30 days of prior work accumulated and documented history prior to being able to be eligible. So.
Yep, thank you for that, Dr. Johnson.
Any other questions? Thanks, Dr.
Thank you all.
Any questions from anyone on the reports? Okay. I mentioned this to Dr. Hughes, but I am just throwing this out because I want your feedback over time. I mentioned to Dr. Hughes the possibility of maybe changing the meeting cadence, and so I'm just throwing this to you all to think about it, the possibility of making maybe the first and third Wednesdays from 9 to 10:15 or 10:30 with hard starts and stops to try to accommodate for people's schedule to get here traffic-wise. If you can just think about it and give some thought, we definitely would probably look at redoing the agenda to fit certain things. So, of course, some of the standard reports, but again, just trying to gauge your feedback on that cadence piece, and I'm gauged it now because based on your feedback, if that was to happen, I want to give everybody enough time, ideally, if, like, I'm thinking right now it's the third Wednesday. I'm thinking, do you do the first and third for a hard hour and a half each block? Meaning hard starts and stops so people can plan around them. And I'm trying to budget around the fact of people getting here with kids, us having to wait to start. And so 9 may be a time so we can get in, get out, go adjust the meeting there. So I'm just throwing that out to think about. It's not there. I mentioned it to Dr. Hughes, but I just want people to start mulling and thinking around it and give me any feedback or suggestions. It's not indefinite, but I'm just putting it on the radar to think about to just kind of go. So
clarify, when you say the first and third, you think about having 2 meetings a month that are shorter, or?
yeah, 2 meetings a month that are shorter. Like I said, the meeting used to start at 8 o'clock. We moved the meeting back to 8:30 to accommodate 4 kids. That's still not there. So and the meeting definitely can't go for an hour once a month. So I'm saying think about that cadence. Do we break it up into 2 meetings for a hard time, a hard hour and a half, or give us some extra time in there to do some other things? But and if we go to that, then I can promise a hard start and stop. We can plan around that, go around that, and have something to budget with. But I'm trying to accommodate so we can get there.
Saving most people commute, you're still adding an hour commute both directions. I don't know what that gains with people who don't work downtown.
I hear you, but I'm just, that's why, and I'm not trying to discuss it now. I'm saying I need you to mull it over, because the fact is, if I'm gonna have to make some change to make sure we can get in and out, and at least get the meeting there on time. So, and I'm trying to accommodate for people's schedule, so I'm just saying, give some thought to it. And if we don't get there, we don't get there, but I need to start thinking about it. All righty. If that's nothing there, make a, ask for motion to adjourn.
To adjourn.
Motion by Festus, is there a second?
Second.
Second by Weiss, roll call.
Wade,
Yes.
McNally,
Yes.
King, Festerson,
Yes.
Jones, Rogers,
Yes.
Espinoza, Wilkin,
Yes.
Weiss.